Welcome to Delingpole, a Breitbart.com podcast. Here is the podcast host, James Delingpole.
Welcome to the Delingpole podcast with me, James Delingpole. And we've got a really exciting episode this week, our first ever double header, by which I mean we have not one special guest, but two special guests, both from one of my favourite institutions in the whole world, the Institute of Economic Affairs. So we have Kate Andrews. Kate, what's your job at the IEA?
I work here as the news editor. I oversee our digital output.
And we also have, emerging from his tank, I'm not going to mention the war ever again. Oh no, Kristian Niemitz. What's your job, Kristian?
It's Head of Health and Welfare at the IEA.
Well, the reason I got you both here, and so thank you for coming at short notice, is that last week's podcast I talked to an A&E doctor who gave me an insider's view of just how malfunctioning the National Health Service is. And I kept asking him, okay, doc, so what's your solution? And he said, I don't know, I'm just a doctor and I'm just making as much money as I can from it. And he was creaming it in. If you can work it right, and this guy was working as a locum, you get paid massive amounts of overtime. You can earn megabucks. So he wasn't really interested in reforming this institution, which is bringing him so much money. But I know that because of the ghastly 70th anniversary celebrations that have been forced on us, whether we like them or not, you've been doing, both of you, a lot of media stuff, and you're not necessarily convinced, are you, that the NHS is really the envy of the world? So Kate, you first.
No, I've never been convinced of this. I think Kristian can relate to this. Well, I'm from the United States of America, and I would never recommend that the U.S. healthcare system be imported to the U.K. I actually might recommend that the German system is where Kristian's from. But I think we, regardless of what we think of our own systems, we can both relate to the fact that there is something very unique and odd about the way that the National Health Service is revered by the public. In the U.S. or in Germany or in essentially any other part of the world, you don't get people holding Thanksgiving ceremonies in Westminster Abbey dedicated to their healthcare service, which happened last Thursday. You can criticize the healthcare service, you can critique it, you can, suggest that there should be changes made to it, and it's not considered to be blasphemy. So I find it very strange that we can't discuss this, especially when the NHS ranks so poorly in international comparisons, which Kristian can speak to a bit.
Yeah, that must be odd for you, Kristian. Like you've got that sort of outsider status slightly, and you must come into this weird culture where the NHS is venerated as a god, and to criticise it means you're kind of evil.
Yeah, absolutely. That's been my experience, but I can't really complain about this because I knew before that the NHS had that special status in the national psyche, and I guess I was sort of asking for it. I wasn't expecting to make many friends with what I was writing about it. But it is nonetheless a bit ironic because normally the IEA is associated with radical free market economics. And our work on healthcare here is a bit of an outlier in that respect because what we're doing on healthcare really isn't especially radical by any reasonable standards. And I don't think it would be considered radical in any other country anywhere outside of Britain. If you translated my healthcare book into French and distributed this amongst a left-wing audience in France, I think even they wouldn't find it particularly radical.
Yeah.
Because France, that well-known bastion of free market fundamentalism, has a big private healthcare sector.
Yeah. You probably didn't read it, but I did write a rather damning piece the other day. Headline something like, the NHS is totally evil, it must die. Something slightly understated and restrained in my characteristic way. But one of the points I made was precisely this, that I think the NHS is a kind of a Trojan horse at the heart of the British establishment, which is entrenching the values of late 1940s socialism, which is borderline communism, in the British political and cultural system. Is that not the case?
Well, it is certainly defended in those terms on the left, that it is not necessarily defended in terms of it has delivered these outcomes, but in terms of the values it supposedly represents. But this is where it's becoming really a blind alley, and this is why defenders of the NHS always pretend that the only alternative is the American system, when that clearly isn't the case, because that is when they can take the moral high ground and speak in very broad abstract terms, saying this is about a battle between good and evil, this is about a caring system versus an uncivilized system, and where they can fearmonger, scare people, which is something you couldn't do if you simply compared the NHS to a standard run-of-the-mill continental European system.
Actually, can we nail that one? How evil is the American system?
So the American system is the massive outlier in the developed world, in the sense that it doesn't offer universal access to healthcare. And that I do think is problematic. You know, in any developed country, you would expect that a country as wealthy as America made it easy and accessible for poor people to access penicillin and routine surgeries, and certainly to be able to have treatment in catastrophic events without going bankrupt. I'm not sure I'd use the word evil, but it's extremely problematic. Of course, if you have health insurance in America, you are getting some of the best healthcare in the world. Waiting times are significantly lower than they are in the UK. The technological advancements coming out of the States in medicine benefit the rest of the world, and that often goes overlooked. But, you know, I still don't think it is the system to uphold. But as Kristian points out, it's the only system that advocates of the NHS can relate to or speak about, because if you dare look at any other developed country, you will see that they also have universal access to healthcare, and then they start to trip over their language. A lot of people like to say the NHS is free. Of course, it isn't free. We did a back-of-the-envelope calculation that estimated that every taxpayer is paying, on average, £4,000 a year for it, and that's going up. So it's not free. And then when you note that you are paying for this service through taxation, you might start asking questions like, well, you know, why are thousands more people dying from common types of cancer in the UK than they are in Germany or Switzerland or Belgium? And, you know, these are crucial questions that people who blindly adore the NHS don't want you to ask.
Yeah, well, okay, so if I live in America and I'm paying $4,000, well, that's probably, sorry, $5,000, isn't it, probably?
Rough, yeah.
Would I get...
Roughly.
Would I get decent healthcare for that, or would I be paying more?
No, you certainly would. I mean, it depends. It's a complicated question. It depends state by state. There are all kinds of top-ups and benefits you can get. But yes, I mean, if you are paying for health insurance in America, you are likely accessing some very top-quality care. Yeah. And then the question is, you know, how are people who don't have that money covered? And they're covered by a system called Medicaid, which is essentially the government's version of the NHS over in the USA. And it's appalling. It's really bad. And it's bad for patients, and patient outcomes are abysmal on Medicaid. So, you know, the US does actually have its own mini form of an NHS, and it's not very good.
Right, so it is even worse than our worst hospitals?
That's really hard to say in a country as big as the NHS, but you could get some very poor quality care in the States. That's definitely true. If you have the money to access it, you're probably getting some of the best care.
Right, okay. And where, Kristian, if I wanted to live anywhere in the world, where's and obviously this is a concern to me as I get older. I don't want to be dying in misery and pain. So where should I be living?
Okay, so what I'm doing in the NHS book is I'm describing a mashup of various systems. I'm looking at the most liberal continental European systems, and I'm describing what it would look like if you took the most liberal elements of each of them and put them together, what kind of healthcare system you would then get. I do that rather than recommending one specific country. But if there's maybe two examples that come up repeatedly in the book, it's Switzerland and the Netherlands. Because these are, well, there is a family of systems which is called as the social insurance system or the Bismarckian system that exists in a number of places, but Switzerland and the Netherlands are at the more liberal end of that spectrum. So those are the insurance systems that are closest to a free market perhaps, but that are also universal. There is no uninsured population in those countries. Right,
okay, so how much would we be paying if we had that kind of system? Probably the same, but they'd work better.
Yeah, you would. Well, total spending in those places is a bit higher than here.
Right.
But that is partly because, first, they make it relatively easy to top up the healthcare that you get through your regular insurance. You can, for example, request single room accommodation at a hospital, or you can get medicines that are deemed too expensive, that are not fully covered, and pay a bit more for that, which would be hard to do on the NHS. Here it's either you get something and it's completely free, or you can't have it at all. But you can't say, well, can you reimburse at least the cost of the standard treatment and let me pay the rest if I want something more expensive.
Yeah.
You can do that in those places, and that's one reason why they pay more. And more generally, it depends on the kind of healthcare policy that you have. You have some control over how much it costs you. You can, for example, specifically in Switzerland, you can go for a standard insurance contract where you can go to any specialist, any doctor, any hospital in the country that you like without any restrictions. That is then pretty expensive. But you can also opt for something like what we have here, a gatekeeper system, where you have to register with one GP and you can't go directly to a specialist unless you get a referral. And if you do that, you get a substantial discount. You can get up to a quarter of your insurance premium being reduced for that reason. So if you don't value unlimited freedom and of provider choice very highly, you can get fairly cheap healthcare in those places as well.
Because it is one of the things that really puzzles me, and I imagine it must puzzle you too also, being free marketeers like myself. But why is it that when I want to go out for dinner, if I want to go out for dinner, I can decide whether I want to go to McDonald's, which is great, but not haute cuisine, or I can go to Sketch, the top room at Sketch, and I can pay hundreds of pounds for my dinner if they'll let me in. This applies to cars, it applies to holidays, it applies to schooling as well, actually, to a degree. Every aspect of our life, apart from health, where somehow we're meant to feel good about the idea that we're all kind of on the same miserable level. What is it about the English psyche? Tell me, Kate, you're an observer.
I don't know if it comes down to psyche. I think it has to do with really this lie that has been sold by every major political party for decades now, that there is no alternative to the NHS. So rather than people feeling like their choices are limited, they feel extremely grateful that there is at least one body out there that's willing to treat them. I mean, this lie has been sold on so many levels. I think a lot of people do think that if you didn't have the NHS, you wouldn't have anything at all.
They do. Definitely. And
that's horrifying, and it's completely untrue. But, politicians just have this unspoken agreement that nobody will touch the NHS. And, of course, in the meantime, people are dying. It's a really terrible thing that's happened in our political sphere. And so I don't think it's that people instinctively don't want choice in healthcare. They're deeply concerned that if they were to trade in the NHS, it would result in something worse, or that they wouldn't have healthcare at all. And again, that goes back to this point about, selling the US as the only alternative.
Yeah. I was going to ask you both about your experience in the last week or so talking about this. You've been on lots of TV programs, and Kate, for example, I always find you almost frighteningly reasonable. I mean, I know you're on my side of the argument, but you're not as out there as I am. You're not a Trump fan, for example.
No one's as out there as you are, James.
No, okay, thank you. Say all the nicest.
You get the trophy.
Say all the nicest things, but it surprised and horrified me seeing you, nice, reasonable, likeable, fact-based Kate, getting the same kind of shit that I get for being slightly more aggressive in my style. I mean, the hatred you got from, for example, what's his name?
It's pretty vile. Well, a lot of eggs on Twitter and trolls have the nastiest things to say, usually connected to deportation. Kristian, I don't know if you get that as well, probably because of our accents. Just not being able to engage on anything. But Paul Mason, who I've done several TV interviews with.
Who's a BBC former
Newsnight editor, yeah. And then also with Channel 4 for a while, and now essentially freelancing. I mean, he compared me to Milo in one of his tweets, basically, saying right-wing ideologue kind of stuff, and then directly, made that Milo comparison. I think he said, "What's next? Are we going to hear from Milo?" And I'm no snowflake. It didn't, it doesn't bother me too much, but it is frustrating that to even suggest that, as Kristian says, France, of all countries, a country that's considered to be quite further to the left than the UK, that France might be getting something in their healthcare system right. To suggest that is to be this extreme right-wing ideologue who wants to privatize the NHS. This is just not reasonable. It's not sensible in the slightest. And, at the same time as well, you get a lot of people with, what's the hashtag, FB something? The people, like, follow back Europe forever, or whatever the hashtag is.
That's FPP.
Yeah, yes, that one. I mean, you get a lot of pro-EU people commenting about how we have nothing to learn from Europe. That the NHS is the best in the world, and everyone who doesn't want to respect the vote to leave the European Union and wants to stay in is really trying to tell me that we have nothing to learn from Germany or France.
Yeah, and I imagine, Kristian, because of your German heritage, people might have said things about you which you found very hurtful. Perhaps you'd like to share those hurtful things with us.
Well, oddly enough, deportation arguments, of course, I've heard that as well, but almost never in connection with healthcare. And I think that's not a coincidence. That relates back to what I've said before, that NHS campaigners are most at their ease, most on their home turf, when they can talk about it and when they can take the moral high ground. Talk about a civilized system that takes care of people and a savage system that lets people die in the streets. And that's why they're so keen to either only compare the UK to America or to the Victorian era or to some other completely irrelevant, exaggeratedly, ridiculously low benchmark level. They know, I think, at some level that they couldn't do this if they made it about the NHS versus the German system.
Yeah.
And that's why they don't. That's why they absolutely don't. That's why it's much more likely that they tell even me that, oh, you're trying to bring in the American system. Even though I really have zero connection with the American system at all.
Yeah.
It seems to me that the debate on the NHS is just like a more extreme version of the thing that we go through every day of our lives as people who believe in free markets. We go out there and we talk about stuff like the Laffer curve, or we talk about why socialism is failing in Venezuela, and why the problem with socialism isn't that it hasn't been tried properly, it's the problem is built into the system. And every time they come back, not with arguments, but with ad homs, with straw men, with all the battery of rhetorical fallacies that they enjoy using. But it seems to me that the NHS is a more extreme version of that, where they really don't even attempt to make any form of argument, other than that if you don't like NHS, you're a bad person.
Yeah, that's my experience as well. It's not qualitatively the sort of pushback you get for saying something against, for criticizing the NHS, is not qualitatively different from the usual hysterical screeching that you would associate with the Twitter left. There's just more of it. There is a lot more.
And it filters into the mainstream.
Yes.
Yeah.
So last Thursday, when that was the anniversary, wasn't it?
Yes,
last
it was.
Thursday,
It was its birthday, Kristian.
Oh, it was its birthday, yes.
Birthday, sorry.
Happy 70th birthday.
Well, I logged onto Twitter because I'd been offline for a while, was doing a radio interview.
You've been invading Russia, hadn't you?
Yeah, the usual.
Yeah.
Operation Barbarossa, finishing the job, that kind of stuff.
Yeah.
I was then, after reaching Stalingrad, was logging onto Twitter again, and I had something like 200 notifications, all of the unquotable variety, and I thought, well, what is it this time? And clicked on it, and I saw the IEA account had reposted an old article of mine, which I had written for the Independent, saying the NHS is an overrated system, and that then got retweeted again by Paul Mason, and that led to a massive pile-on. And yeah, but again, I can't claim that I was surprised about that. That's just the nature of that debate, for lack of a better word. But yeah, there is more of it, and it goes beyond the usual egg accounts.
You're listening to the Delingpole podcast. This is the NHS 70th birthday. Happy birthday, NHS Special, Part 2, starring Kate Andrews and Kristian Niemitz of the Institute of Economic Affairs. More in a moment.
Breitbart News Daily with Alex Marlow.
Censorship is a key issue here, particularly for people on the right. Do you think it was addressed adequately?
Definitely not. It was useful to name check Diamond and Silk. It was useful to check even politicians who had campaign ads that were shut down. But in every case, Zuckerberg was allowed to essentially dismiss the case and move on.
Breitbart News Daily, weekdays at 6 a.m. Eastern on SiriusXM Patriot 125.
This is Delingpole, a Breitbart.com podcast. Here once again is James Delingpole.
Welcome back to the Delingpole podcast with me, James Delingpole, and my very special double act guest today, Kate Andrews and Kristian Niemitz, for our special We Love You NHS, You Are the Envy of the World. Not really. Before we go on, before we talk about it any further, this morning I went to have a blood test at my lovely local country surgery. Got seen by the nurse, free. Like the doctors there, they're really good. I've had some good treatment at the NHS, as well as some really shit treatment. I think we can all agree, can we not, that you don't, when you're against the NHS, you're not against the principle of doctors or nurses or healthcare. It doesn't mean you hate everyone involved in that kind of thing.
Certainly not. This is one of the most frustrating things, is that I think it's quite natural for people to feel an affinity towards their doctors or nurses or the surgeon who saved their life. I mean, that kind of gratefulness is pretty normal. What's weird is when you celebrate this bureaucratic, faceless system that processes people through this, centralized body located in Westminster. What is there to celebrate about that, especially when it just turns out that it's not very good? But yeah, people do think that an attack on the NHS is an attack on the workforce. Of course, we're seeing more and more doctors and nurses travel abroad, especially to places like Australia, where it's fairly easy for them to move to practice medicine because the pay is better, the working hours are better. I mean, it's not just about patients. Other systems treat doctors and nurses better too. And that's a really big frustration when, I know that there are big exceptions to this, but the medical profession in the UK does seem very ideologically attached to the NHS. But it's not obviously helping them. I
was going to ask you about that, and you've kind of answered the question. It seems to me that when I described it as a Trojan horse, a leftist Trojan horse, it seems one thing it has done is what's the opposite of red pilled? It's gone and blue pilled the medical profession and turned people who might not have been, particularly, I mean, when you're earning a GP salary, they're earning 100,000 plus a year, aren't they? They're being pretty well paid at the top levels. These are people who ought to be sound conservatives, who ought to believe in free markets and stuff. And instead, they're all bloody Reds.
It's a very groupthink-prone profession, I think. I have spoken to doctors and other health professionals who told me, look, between you and me, I actually agree with what you write, but I would never say that in front of my colleagues. So definitely the kind of medical professionals that you come across on social media, they're extremely groupthink prone, and they're pretty much all on the hard left.
Yeah.
But that's they seek each other's validation. So you can never just debate with one of them. If one of them has a go at you, then 3 minutes later you have several hundreds coming at you because they all tag each other in and do their usual mob online pile-on thing. So it is just that psyche. Mob psychology.
But it's indicative, I think, of the groupthink that even Jacob Rees-Mogg feels utterly incapable of speaking out against the NHS in any way. I mean, when I've heard him speak about the NHS, it's like, I don't know whether he actually used the phrase "our NHS," but he did, metaphorically, if not literally.
I mean, that goes to the point that it's just, there has been this unspoken agreement between politicians for so long that they won't touch it. If you are that one politician, you're going to find yourself out of a job. And I have some sympathy for this. I'd love to see more free marketeers climbing that political ladder, but, they won't have that opportunity to make any change if they attack the NHS. But I think this brings us on to a really important point, and quite a frightening one at the same time. The NHS is getting worse. It's crumbling. We're seeing those tears. 50,000 operations canceled in the month of January. It's just so that A&E could keep up with their demands. People are getting hurt in this process. We see thousands of lives lost every year that are unnecessary if people were treated on different systems. And Kristian can speak to this as well, but the way that demographics are shifting, this is likely to only get worse before it gets better. So what's going to happen? Is a politician going to put their head up and say, you know what, we have to tackle this now so that there is an NHS here in 10 years? Or are they really going to let it get so bad that it breaks and then they have to pick up the pieces, but that could take a decade, and many people could get hurt in that process. I'm absolutely not convinced that they're going to be brave. I'm not convinced they're going to have the hard conversations now. I think this could mean really terrible healthcare outcomes in the future. I mean, a lot worse than what the NHS sees now. I don't know if Kristian agrees.
Yeah, I'm pessimistic as well, but I guess if something happens, it will be more through the back door. So there have been some improvements under the last Labour government, some actually pretty good things happening where they brought in more patient choice, a system where money follows patients to some extent, so imitating market mechanisms within the NHS to some extent. That was fairly timid. It's still miles away from a relatively normal continental system, but relative to where it was before, that was an improvement. But it's not something that they sought a consensus for or tried to engage with the public. They just brought this in and with the rhetoric of move on, nothing to see here. So try to keep it low profile, low key.
It's almost as though Labour, being seen as the party of the NHS, is prepared, or has been prepared, to be more radical than the Conservatives, who are terrified. I mean, you've seen that. How much did Theresa May bung the NHS recently?
It's going to be roughly £20 billion extra a year. It doesn't kick in right away, but that's roughly what it's going to be.
Right. And actually that promise rather backfired, didn't it? I think rather encouragingly.
Well, it doesn't look like it had a huge impact in the opinion polls.
Yeah.
Which just goes to show that you can't beat Labour at their own spending game, especially at Labour as it exists now. It's an interesting perspective that perhaps Labour can take more initiative and change the NHS more because the public trusts that party more with the healthcare system. But I think this is more down to the fact that Tony Blair, was not a free market liberal in the truest sense, but much closer actually in many ways to the Conservative Party now. And that the Conservative Party is essentially, it's not even Ed Miliband light. It's adopted price caps. It's not liberalizing the planning system. It talks about healthcare like it should remain this centralized bureaucratic body. So there are many issues with the party at the moment, and I'm not sure that this is just simply left or right. The world that we're living in politically in the United Kingdom now is just significantly more populist, to the left, all those things.
Yeah, and they've also burnt their fingers early on in the coalition years. They brought in a relatively pointless reorganization of the NHS. That's one of the problems with a politicized system, that you get reorganizations all the time because every health secretary feels obliged to leave a legacy behind. And anyway, that was immediately attacked as an attempt to privatize it. It was because nothing of the sort. It's just that every time there is some healthcare reform, somebody screams privatization, and then lazy journalists copy it, and it gets picked up more widely. And this is what happened in the coalition years, and then the Conservatives must have decided, oh, we better stay away from the NHS. We can only lose on that front. Yeah.
It does seem to me that the argument has been, on healthcare, has been entirely conceded to socialism, which is bizarre in that we ought to be a kind of post-socialist society, and yet this key area of our national life is, you're good on socialism, Kristian. Tell me about the model, when it was established in 1948. Who were the people involved in it?
It was essentially a one-man show. It's been reinterpreted afterwards as having been created in response to public pressure. That's the conventional narrative that you read from people like Owen Jones, that it was this massive working class uprising. They demanded a nationalized healthcare service. But actually we have pretty good survey data and qualitative research into public opinion at the time, and there really was no popular demand for this. There was most people were relatively indifferent. There was demand for reform of the interwar system, but not in the sense of a government takeover. And nobody really talked about it until Bevan brought it in almost single-handedly. And it wasn't really known until a couple of weeks before the NHS Act was passed what he was actually up to. So even within his own party, that was not a consensus. That was pretty much his own one-man show.
Wow. Who was Bevan? I don't know much about him.
I don't know much about him either, but he was a Welsh socialist. And
he was a proper old-school socialist, and he
yes.
And he modelled it on socialist lines.
Yeah, I think by that time he had at least moved away from Soviet socialism. I think he was a Soviet Union admirer earlier in his life. But in the 1930s, they all were. So that's pretty normal. And then by the 40s, he had moved away from that, but remained a hardline socialist and still had, I guess, this Leninist view that social progress is driven by a smart, educated elite like himself.
But am I not right in thinking that one of the very few areas where the NHS comes high in international tables is in equity of treatment?
Yes, well, that's true, and it ranks pretty well. I think it ranks towards the top when people are asked if they would ever put off seeking medical treatment because they were concerned about costs. Obviously, on the National Health Service, people say absolutely not.
Which is a double-edged thing, because it means if people have got a slight sniffle, they're going to go to casualty and hey, they'll get it free. Yeah, no, there definitely are some issues there. But it does rank high in terms of equity. Of course, it's equal care that isn't very good. I would much prefer to see a system where equity was a little more off balance, but the lowest quality of care was higher than it is on the NHS for everybody else. So, I think it definitely seeps into this debate around inequality versus poverty and prosperity. I mean, you want everybody to have the best access that they can possibly get to something. And oftentimes in systems that are striving for equality, you're just bringing down the care for everybody. And we also forget so often that the NHS is a rationing body. I mean, that is the only way it can function. It has to deprive people of certain things. It was outrageous that the first big announcement to come out of the NHS after the Prime Minister pledged the 20 billion extra a year was that they were going to cut 17 surgeries. Some of them, perhaps a bit outdated, but some of them are necessary for people who are in pain. And, this is the NHS. It is a rationing body. It is not free. People are paying through taxation, but they're also paying through getting rid of certain things that they can access. Have you looked into where the most egregious areas of waste are? For example, I mean, when I write about this stuff on Breitbart, I get lots of people saying, well, of course, the problem with the NHS is all these health tourists. But I suspect they're not the most significant problem with the NHS, are they?
They're hardly a problem at all. Health tourism is mostly a myth. That is, I've looked at the figures once, I don't remember them exactly, but it's less than $1 billion that is spent on health tourism. And even that is, no, actually a lot less than $1 billion. But either way, even that is mostly not so much a matter of somebody coming here and taking advantage of the NHS. It's just that NHS organizations are bad at reclaiming those costs afterwards. If you go on holiday anywhere in continental Europe and you go to a doctor, you have to show you either your European health insurance card or some other form of identification. And here they don't do that, or if they do, they don't follow up later on to reclaim those costs. So it's more an accidental health tourism. It's not that somebody deliberately comes here to take advantage of the NHS. Yeah. And it's more that somebody comes here who is either a tourist or a temporary resident, and who then goes back to their country of origin, need healthcare at some point, and those people would have complete coverage, health insurance in their country of permanent residence. And if the NHS was just a bit more efficient, they would just contact that insurer and say, here's what we provided, you owe us £2,000.
Sure.
Works everywhere else.
I suppose what I'm asking is, if you added up all the people who shouldn't be being treated by the NHS, who are being treated by it, and the NHS not getting the money back, I imagine even if you sorted that out, you would barely have dented the problems with the NHS.
Barely. Health tourism is not what is crippling the NHS, and it's deeply frustrating when people suggest that it is, which we should also note that health tourism of Brits going abroad to seek treatment in Europe is on the rise because, again, to that rationing point, they can't access the treatment in the UK in a timely manner.
So where is the real rot within the NHS? Presumably, it could be doing a lot more with the budget it's got than it is.
Yeah, I've deliberately avoided trying to look at micro questions here because I'm an economist. I can't talk about clinical issues or hospital management. I don't know anything about that. I look at overall system level figures, but there have been estimates of overall efficiency by the OECD and other organizations. where they look at how efficient systems are turning inputs into outputs, and they always have the NHS pretty low in those rankings, about on a par with the Greek healthcare system. They don't specifically identify where that comes from. Those are macro level models, but nonetheless they tell us something.
I'm just figuring, for example, I always think of Israel when I think of a kind of, hardcore. So I bet the hospitals are really good in Israel. No, I'm just imagining.
Yeah, they're very high on those efficiency rankings.
Yeah, exactly. And I can just imagine that Israeli hospitals they don't let their patients get MRSA, for example. They don't get them. There are not the issues to do with bureaucracy and inefficiency that obtain in our system.
Well, again, to speak broadly about it, which I think Kristian and I are a bit more placed to do, you are getting the management and the bureaucracy that is necessary for those systems to work efficiently. Whereas in the NHS, you're pouring money into a system without any response from your customers. So it's really difficult within the NHS to get those kinds of efficiency gains because you are not seeing the market in action in any sense.
No.
And when you do bring patient choice into the matter, you start investing in the areas that patients are suggesting they actually want to receive that treatment. So it's much easier to have efficiency gains when you're actually having a market reflecting back to you what's in demand.
Well, is it fair to say that the NHS is running the interests of the producers, not the customers?
Well, I would think so. I would agree with that.
Broadly, but as we said before, a lot of the producers don't seem particularly happy with it either. Constantly complaining we have a relatively high rate of doctors leaving, or at least a drop in applications, fewer people who want to do it in the first place. So it doesn't seem to work terrifically well even for them.
Yeah.
And that's maybe one of the ironies. That's the standard economic theory. That's what you would expect. That a nationalized industry that isn't subject to competitive pressures would become provider-captured, producer-centered.
You're listening to the Delingpole podcast with me, James Delingpole. This is our Happy Birthday NHS Special with Kate Andrews and Kristian Niemitz of the IEA. More in a moment.
Breitbart News Tonight with Joel Pollack and Rebecca Mansour.
I think that it's the epitome of hypocrisy. Unless you fall in line with their liberal agenda, this uniparty, globalist, liberal agenda, they will never support you. They use the whole gender issue, of course, as some kind of tool to prop up their messaging, but it's the phoniest thing.
Sirius XM Patriot, Channel 125.
This is Delingpole, a Breitbart.com podcast. Here once again is James Delingpole.
Welcome back to the Delingpole podcast with me, James Delingpole, and my very special double act from the IEA, Kristian von Niemitz and Kate Andrews. I'm not going to do that ever again. I wanted to ask you, Kristian, were you here for the Olympics opening ceremony?
I think I escaped it, but I used it later, the image, for PowerPoint presentations.
Okay, so
pretty cringeworthy.
You're familiar with Danny Boyle's propaganda coup, which was basically that the opening ceremony was history as it would have happened if you were a lefty. So first of all, we had the Industrial Revolution, which was a really bad thing because the lovely idyllic English countryside was replaced by these dark satanic mills. Mm-hmm. And then we had the other glory of English history, British history, which was, of course, the NHS. And you had Mary Poppins and kids bouncing up and down on beds. And, of course, the subtext of that is, before socialism came along, there was no healthcare in Britain. Is that the case?
No. There was a system which started to develop from the mid-19th century on, which was a system of mutual insurance organizations, mostly run by some working class organization, trade union or something else, based on around some industry or some large employer. But either way, it was a cooperative mutual insurance system, self-governing and largely non-state. Now, this system, we don't know a lot about it. The data is quite patchy. There were gaps in coverage. Not everybody had health insurance at the time. So therefore, it was appropriate that after the war that there would have been some effort to close those gaps, and that is something that I think would also have happened if the NHS had never been set up, because that's simply what happened in other places that haven't adopted that kind of system. That if you take the Bismarckian system, that was also based on existing mutual insurance organizations that were already there. It's just that not everybody had them. And it's not true that Bismarck created them. It's just that he formalized and standardized a system that was already there. So he made it mandatory to participate, and to some extent standardized a bit what they did, what they had to cover. But in that way, you can make a system universal without having the government taking it over. Yeah. That's what happened elsewhere. That's the Bismarckian system, and it's many relatives in the neighbor countries, and that is pretty much what would have happened in Britain if Bevan had never lived, if the NHS had never been set up. In fact, I start my book with an alternative history. I'm slightly obsessed with that format, and this is an alternative history in which I can't quite remember how I spin that. I think Bevan gets killed in an air raid by the Luftwaffe, and either way,
whose Luftwaffe would that be?
Oh, that's
why didn't
whichever you like.
Kristian, why didn't your lot? You blew the perfect opportunity. You didn't succeed when you were needed.
Well, when time travel is invented, that can be looked at again.
Yeah, I very much hope so. Right. Well, yes, there is this. Kate, you must have experienced this in the last week or so. This what Kristian's more or less describing there, which is that there is this mentality whereby people think that if there were no NHS, there would be no healthcare at all. Mm-hmm. How do you?
Well, did you watch the BBC Two's NHS at 70 programme? The massive celebration, which was I believe it was last Tuesday. It might have been the week before. It all blurs together, these celebrations, but it was truly remarkable. If you had been watching it as an alien from outer space, you might have genuinely believed that without the NHS, there would be no healthcare, there would be no babies born, that nobody's mother would be saved from cancer. I mean, the attitude is truly that my baby being born is thanks to the National Health Service. Not the nurse, not the doctor, not the tax money I paid to make sure that this could be feasible, but to the NHS. And you just have to ask yourself, what do they think happens in Switzerland? What do they think happens in Australia? I mean, are babies not born there? And I think it's a deliberate inward looking. And people like the idea of the system, and they just don't want to totally acknowledge how dysfunctional it actually is.
Yeah, but isn't that, broadening it out a bit, isn't this exactly how totalitarian regimes conduct themselves? They don't want people to look into the arguments. They don't want people to look at counterfactuals or anything like, or alternative systems, because if they do that, they're busted. So instead, what they do is they hype up the propaganda. So you've got kind of tractor production statistics in the Soviet Union. You've got the Great Leap Forward in Mao's China. And isn't not the case that our NHS is treated in much the same way? We're given this propaganda myth by the BBC, which is the other institution with 3 letters, which should be, in my view, abolished to save the country.
I'd say it's worse, because there isn't even a propaganda ministry that is forcing this on the population. It's more a voluntary groupthink and a lot of self-censorship and doublethink going on. But it isn't coordinated. Of course, the BBC doesn't help, but it's plenty of other news sources doing this as well.
Yeah, ITV had the NHS sing-along. I mean,
did they?
Yeah, they had an NHS sing-along. There have been songs created by all different groups, all in praise of the NHS. Kristian's completely right. It's not just state-funded entities that are pushing the NHS rhetoric. Absolutely everyone is doing it.
Yeah, it can look a lot like the celebrations of Kim Il-sung's birthday in Pyongyang, those sort of celebrations.
Yeah, well, that's really frightening. So it brings me around, if this podcast has a running theme, it's how do we win? Given that everything is so completely screwed, given that this is how people think, and it's, you're right, it's willing groupthink. It's not, they're not kind of being bullied to think this way by the state. They are actually, people voluntarily think in this stupid way. What have you found, first of all, Kate, as the most effective penetrative argument that gets through into their thick heads?
I find the most effective argument is that there's something outside of the NHS in the USA. A lot of people don't want to hear that, and you just can't argue with those people. The number of people who still respond, but what about the USA, is really quite enormous, but they're not listening, so they're not going to have their minds changed. But I do find, if anybody's open-minded, the most effective argument is to say, would it be so bad if the UK's healthcare system looked like the Netherlands? Given the fact that you're always talking about their tax system and everything else about them, would it be so bad if our healthcare looked like that too? And I think that's probably the most persuasive. Kristian, what do you find?
Yeah, absolutely. That's my experience too. And that's precisely because it is a bit odd. What we're doing here is something that people on the left do all the time, which is compare Britain to its Northern European social democratic neighbors, which is a bit unusual for the IEA. That's why some people who have read my earlier stuff came back and said, really? Is that all you got? Normally you people talk about places like Hong Kong and Singapore and Chile, and now what's this? The Netherlands. Is that all? But I think that does work.
But sorry, yeah.
I just want to come back to Kristian's point as well about sort of the IEA's. The IEA doesn't have a corporate line, but most of the work coming out on healthcare is written by Kristian and backed by most of our spokespeople. And I want to go back to this point because I think that maybe there is just this disbelief that the IEA might be putting forward a hybrid idea that combines the public sector and the private sector. Because, usually we are saying, everything's better in the market. But, we acknowledge that everybody, Kristian and myself included, want people who aren't very wealthy to have access to healthcare. You have a better society overall if that's the case. The best healthcare we can get those poor people in particular is through market mechanisms. And that's why we push what we do. But I think a lot of it actually comes from the fact that people just don't believe it. They're like, oh, you're talking about the Netherlands, and then you're going to abolish healthcare. Without any evidence that we take that second step. But they just can't possibly believe, as Kristian says, that we might like those systems.
Yeah, I remember a panel discussion on this where it was 3 anti-NHS people, 3 pro. I was obviously on the anti side. I started my contribution by saying, let me start by making clear what I'm not advocating. I am not, and I repeat, not suggesting that we should emulate the US system. Then, coincidentally, the 2 other people who were on my side said pretty much the same thing. And the 3 people on the other side were banging on about the US system, of course, the whole time. And then somebody in the audience said, wait a minute, why are you all 3 so obsessed with this system? The 3 guys on the other side, they've all said that that's not what I want. And one of the speakers said, yeah, they may say that, but the US system is always there in the background. The truth is, of course, it is always there in the background because those people are bloody obsessed with it.
Yeah, they're the ones who bring it up. James, you and I had a similar experience at Durham University.
We totally did.
And we won, which was amazing. But our opposition was very well-meaning, and I think we had a nice drink afterwards. But all they could do was talk about the US system. They could not even mention a single other country. And you and I could list them.
It was you were why we won. I mean, I was
no,
just
it was a team effort.
Entertainment.
But
the fact that you were American but explaining it from a knowledgeable position, and they couldn't get it past our defence, and also it helped that we were at Durham rather than Oxford or Cambridge, which have fallen, haven't they? By the way, just before we go, what's wrong with the Singapore model? I thought that was kind of a good one as well, isn't it?
Yeah, they have different demographic structure. That's a younger population, and generally speaking, I think healthcare isn't something that you can save very well for. Saving is all very appropriate for things that you can plan. If you want to buy a new computer next year, then yeah, of course, you save for that. Healthcare isn't like that. Your healthcare needs next year could be £0, they could be £1 million.
And also, there's, I think, an element that you have to work within your current framework. And Singapore has such a free market attitude that, people have these healthcare savings accounts, but to go to the doctor, to go to an A&E is still extremely inexpensive. on the whole. I mean, their free market system's actually at work. So it is theoretical. You know, I agree with Kristian's completely right about the planning aspect. But to go to the doctor does not have the kind of cost associated as it would here in the UK or really anywhere in Europe.
Yeah, so such a system would only make sense if you were prepared to say, once you've run out of money in your account, you can't get any additional healthcare, which in most cases wouldn't happen, but some would. And then what would happen then? Here, if you had one news story about that, that would be the end of that system. And you could then, of course, go to a system where the government then jumps in and tops up that account, but then it becomes meaningless if it becomes a bottomless pit.
You said, Kate, that you thought the NHS might break. What would it look like if the NHS breaks?
I mean, I'm no fortune teller, and I don't really want to predict this because it's so awful. It's definitely not something I hope for. But, I mean, we got a little taste of it in January this year. 50,000 people were not able to access the treatment they needed. And, you know, they claimed they were canceling non-emergency surgeries, and to some extent that was true. But if you're in a deep amount of pain waiting for your hip replacement or your knee surgery, and you're told, really sorry, you know, back to the end of the queue, you're not getting that this month. I mean, I personally think that is necessary. I think it's ridiculous in a developed country like the UK that people have to wait, you know, 18 plus weeks in order to get those treatments. So I think we got a little flavor of it. I don't know how much worse it gets. But you know, it's very, very clear that the system cannot handle the pressures that are being put upon it at the moment. And so they're going to start by cutting back the non-emergency surgeries, but what is considered an emergency, that definition is going to change, and it's going to be really painful.
Yeah. What do you think is going to wake people up, Kristian? Can you think of anything that might happen to change this entrenched?
Well, yeah, if you had some dramatic event, but I don't think there will be a dramatic event. I think there will just be more and more rationing through the back door. Waiting times getting longer and more treatments not being made available. And the doctor is not going to tell you there is an amazing cure for what you have out there. It's just too expensive and you're not going to get it. They're either not going to tell you at all that it exists, or they're going to downplay your symptoms and say, go home and take paracetamol. It's that there won't be one big bang event. It will just fall more and more behind comparable systems.
Yeah.
But since we don't normally have that comparison, we don't normally travel between countries and experience different healthcare systems in the way that we may experience different pop cultures in different places. Since healthcare isn't like that, it is not going to be widely known.
I think I'm going to have to move to Switzerland, you know. I don't see any way around this one. Final question, and a lot of people have been asking me to ask you this. Who funds you?
Who funds you, James?
Yeah, obviously Bupa and Big Evil. I mean, this podcast was sponsored by my future private health insurers. My
favorite tweet recently, I did a newspaper review, and someone tweeted at me, she keeps looking down. I guess she's, you know, reading what, you know, her overlords have told her to say. And I just responded saying, well, you know, actually it's a newspaper review. People kind of expect you to read off of the newspaper. Also, obviously I'm funded by Big Inc. You know, that explains it. That explains the whole thing.
Yeah, looking down is probably a signal that you're lying or something as well. I mean, you would lie if you worked for
if you worked for Big Inc.
Yeah, Big Inc.
Sure.
Yeah. Okay, well, it's been lovely having you both on the show again. It's the second time now for each of you, isn't it? So welcome back, Kristian and Kate, and thank you very much for a great show. You're listening to the Delingpole podcast with special 70th Happy Birthday Party edition. Till next week, goodbye.
Sonny's Corner with Sonny Johnson.
I want to actually take a couple of the references to Donald Trump from hip-hop. And then we're going to try to see if we can figure out why they like Donald Trump. Jay-Z said, I'm at the Trump International. Ask for me. Raekwon said, I'm the black Trump. They are comparing themselves to what he represents. His wealth, his achievement. Capitalism.
Sonny's Corner with Sonny Johnson. Saturday from 1 to 3 p.m. East on Sirius XM Patriot 125.